හිත නිලධාරියෙකෝ නිලධාරිනියක් විදියට ඇයි ඔබ සිංගප්පූරුවේම රැකියාවක් තෝරගත යුත්තේ? දැනටම සිංගප්පූරුවේ නවීන පන්නේ රෝහල්වල වැඩ කරන අපගේ ශ්‍රී ලාංකිකයන් ඔවුන්ගේ අදහස් අප සමග බෙදාගත්ත මෙන්න මේ විදියට.
Good morning. What's your name?
I'm Mohoti. They know me as Mohoti.
Okay, Mr. Mohoti. Okay. So, first of all, can you tell us a bit about yourself?
Yeah, actually, I have been working as 15 years in Sri Lanka as a staff nurse. Now, currently, I am working in 𝐐𝐚𝐿NC Hospital in Singapore. So, actually, before also, one year I worked in Singapore as a nursing aide in one nursing home. This is the second time my experience a bit different, like in Sri Lanka to here, because in Sri Lanka I worked in surgical ward, medical wards, orthopedic, accident department, so many places. Here I am working in general ward. So general ward means my one is the A-class paying ward. So every patient is there, surgical ward, the surgical patients, medical patients, and orthopedic patients also. So because of my experience, it's helpful to hear. Yeah.
Okay. How long you are in Singapore now?
Actually now 6 months already.
6 months. Okay.
6 months already, yes.
Okay. So, do you know you are working in one of the top 250 hospital in the world? So, what is like working in top hospitals?
Yeah, actually, my hospital, 𝐸𝐿NC, is the 130 ranking in the world hospitals.
Okay.
So many things than Sri Lanka. Actually, here all the not the paperwork based, all the computer based. First time, I'm also a bit afraid whether I can tolerate this and can adapt this, but it's easy because in my hospital they have no blame culture, so they always teach to each other, and I have my own preceptor, so she always guide me, and I have my own reporting officer. She always observe me. If I do anything wrong, they just correct me. And very technical things also here. Everything upgraded than Sri Lanka. Everything. I mean the nursing part. Then the equipments also so new. But they teach each and everything regarding the system and the computer system and the equipments and the nursing things. Everything they teach. Actually, when we engage with the hospital, they already arrange us a few training sessions. Actually, 10 days training sessions they arrange for us. So they give the broad knowledge regarding the Singapore nursing and what we have to do there. So I can say the newcomers no need to worry to come to Singapore because they already give us the knowledge also regarding the system, the everything.
Okay. So, having worked in Singapore for some time now, how do you find the facilities there?
For me, I'm okay because if we stay so little bit far from the hospital, also the transport facilities is okay because train line also have, bus also very available. So no need to worry regarding the accommodation or whatever because we always try to compare with the Sri Lankan rupees and the Sing dollars when we are finding place or buy something, but it's not fair because we are earning in Singapore, so we are spending the Singapore dollars. So I think the facilities and the money also okay.
Okay. So, you working as an enrolled nurse or a registered nurse?
No, I am working as an enrolled nurse.
Enrolled nurse. So, as an enrolled nurse in Singapore, do you think you can be promoted as a RA? What do you feel?
Definitely, because I'm not a degree holder. I'm diploma holder, 3 years diploma holder. when I'm working, some staff nurses are asking me why you come as a enrolled nurse. You also have the experience and the diploma, because I saw a lot of the staff nurses there as they started as the diploma, but they are working as the staff nurse. Then they have the path also. We can go through our system and can upgrade.
Okay. And from what I see, innovation is part of the nursing culture in Singapore. How are you adapting to these innovations?
Yeah, first we think it's a bit challenge, but no, because the new innovations also there, but they teach everything. First also I told you, they teach everything. The simple things also they teach how we adapt with these smarts. Actually, we have the smart board, the lot of the new innovations, lot of new technicals, the technology here, but they teach each and everything. Some equipments also a little bit different than Sri Lanka we are using here, but no need to worry. They teach everything.
Okay. So as Sri Lankans, we are not fluent in English. So there will be some language barrier issues.
Yeah.
But how you adapt into their language and the nursing trainings? Can you explain us how the job training went well when you first job in the hospital?
Okay, regarding the language barrier, actually, I want to say that some other countries, nurses also here, they also have like this thing. Only the thing is the accent, when they are speaking. One thing they are speaking very fast, and the other thing is the accent little bit goes near the Chinese language. So if you listen very carefully, you can understand. Only 1-2 months you have the problem. Otherwise, it's okay, fine. You can do with them. You can deal with them because we also can understand each and everything what they talking. So no need to worry about the language barrier.
Okay.
And the other thing is they use some Chinese words, some Malay words when they are talking. Some old generations in Singapore they talking speaking the Chinese and the Malay. Also those languages also can learn, because for me now I can understand little bit Malay and Chinese also.
Okay.
Within 6 months.
Okay. And overall, what do you think about being a nurse in Singapore?
I think it's better, because before we had the dream we need to go Europe countries, they are like that, but after we came here we realized here we can survive. Here the career is very good. I like to invite to the newcomers also here, come and see the difference, because safety, the foods availability, the other things, the learning resources, everything is better here.
Okay. And will you recommend this Singapore vacancy as a next step in your career growth?
Yeah, why not? Sure.
Okay. And what you can tell to the next batches who are traveling as a nurses to Singapore?
Yeah, I would like to tell them to don't be fierce, no need to worry. Only one thing, I think that they have the issue with the family, because currently they are not allowed to bring the family here, but in near future it will happen, because I saw the minister talk to they will grant the PR in near future, so we will try to next time that we can bring our family here. So far, if you come alone, you can survive, you can earn, you can save also. But we must need to know how to manage our salary.
Yes. Okay. And most of the females are traveling to Singapore as a nurse. So what do you think about Singapore? Is it safe for everyone?
Yeah, safe for everyone, because here everywhere have the CCTV. So if we do any unnecessary things, they can track everywhere. Even midnight, also the females can go everywhere without any trouble. No one say anything, because sometimes after finish our evening duty around 9 p.m. the females go back to their houses. No need to worry. Sometimes I see some people, they finish their duty after 12 midnight also. They go back to their houses. No one disturb them. No one say anything. Very safe country.
Okay. Okay then. Thank you so much,
Okay.
Mr. Moti, for the information.
Okay,
Thank you.
thank you very much. Thank you.
What is your name?
You can calling me Dilrukshi.
Dilrukshi. Okay.
Yeah.
Nice to meet you. And Ms. Dilrukshi, I will start. Okay. So, Ms. Dilrukshi, can you explain a bit about yourself and what are the roles you work in Sri Lanka?
Yeah, my name is Dilrukshi 𝐐𝐚𝐥𝐢𝐼𝐜𝐿. So I'm 35 years old. I'm working as a registered nurse in Sri Lanka last 9 years. My hospital was Ledrike Children's Hospitals. I have experience in pediatric nursing. After that, I also completed my BSc degree last year. But after came Singapore, I applied for Singapore with NITA program. So
Okay.
yeah, I applied for enroll nurse position.
Enrollers. Okay.
Yeah, but I have degree, but in here SNB the requirement if I apply registered nurse position, they ask for 3 year experience after degree. So
Yes.
I have to apply EN position. So that's all.
So, how long you're working in Singapore now?
At least 4 months.
4 months. Okay.
Yeah, I came here 6th April.
Okay. So, you are working in one of the top 250 hospitals in the world.
Yeah,
So, what is like working in a top hospital in the world?
it was a nice experience. Yeah.
Yeah.
I like very much. Now I am working at 5C Smart World. Smart
Yeah.
World, now hospitals. There are more innovations like system. All the things are new. Actually, in Sri Lanka, I was a theatre nurse, pediatric cardiac theatre nurse. I have theatre experience. Don't have medical or surgical ward experience. I only have theatre experience. Then came here. I bring heavy acute care medical ward 5C. So my first day is very confused. But after that, now I am passing 4 months. Now I am really feeling well and coping with all locals and international nurses. I'm very happy today.
Okay. And you working as an enroll nurse. So,
Yeah.
how you feel? You think you can promote it? There is opportunities to get promoted for
Yeah. There are
enroll
more,
nurse to
there are
registered
more
nurse?
opportunities. Actually, I have a degree. So after as a enroll nurse, we have to probation period 6 months. After
Yes.
that, and also we have to competency checklist to complete
Yeah.
this period. So after that, we can apply for SNB registration. Then we can get the SNB license as enroll nurse. Then after that, after 2 years, we can apply for registered nurse. So according to our performance, there are a lot of pathways to promote.
Yeah. Okay. So now almost you are working in 4 months in Singapore.
Yeah.
So for some time now.
Yeah.
So how you find these facilities there? Is it difficult to find or?
Actually, after we came here, it's new environment, new people,
Yeah.
new culture. We are very different. So that period of time is very difficult to adjust. But after that, it's depend ourselves actually. If our attitudes and all the things be positive, we can tolerate all the things. We can move very easily.
Yeah.
All the difficulties. It's depend on ourselves and especially our thinking attitudes. If we always think positively, we can win all the difficulties actually.
Okay. So innovation is part of the nursing culture in Singapore. No? So
Yeah.
how will you adapt to that these
Yeah,
innovations?
actually, Sri Lanka, we almost doing traditional nursing. We doing every time documentation and we patient observe patient, then we document every time document. But in here, we use computer-based system. If in our ward, as example, in our ward, every patient has a risk tag with patient name, identification, barcode number, and all the things. We can scan the barcode. We can all the details of patient. We can search out the through system patient personal details, diagnostic, all the lab evaluation, all the things we can see through the computer system. So it's a very good thing. No need to go a lab or a technician, or we don't need to more time to waste. We can overall idea about the patient through this system. Even only one can assess, every medical staff can assess through this system, and they can get idea about the patient, what kind of disease he have, what is the future plans, discharge plan, all the things we can get easily. It's very good. And also in our ward, as a fall risk, there are I told already in our ward, acute medical ward. There are some chest pain, fall risk injury, pneumonia, all the medical conditions patients we have. So and through this system we can evaluate patients easily, and we can do our nursing intervention easily. After finish our nursing intervention, we have to key in things on the system. If I change type of the patient, we have to mention what are the how urine occurrence, pass urine time, what kind of amount, like that. All details we can have to key in the system. It's a good thing. Through this system we haven't missed anything. If I saw the patient's bowel, we can see restore chart. We have to bowel appearance, bowel amount, all the things we have to key. It's a good thing. We haven't missed anything through this system.
Yes. Okay. So as Sri Lankan, we all have that language barrier.
Yeah.
So how you adapt into their languages and the nursing training, and when the first day you join to the hospital, how you feel that? Can you manage with?
Yeah. Actually, their accent is different than us. Since childhood, we have to use to British accent. In here, there are more Chinese. They are use Chinese accent. That's it's first time that was difficult to understand. But after that, we used to their accent. Can do like that. They every time use Chinese word like that. But it's simple. Normally they use simple English. You go, you can, like that. We don't think more grammatically or formal version. You just say what you want to say. Just say. No need to worry.
Yes.
Yeah.
Okay. And overall, what do you think about being a nurse in Singapore? Will you recommend this Singapore nurses to the?
Actually, I'm really well recommended. This system is very good as a nurse. There are very systemized system, and it's very top to bottom. They are very really analyzed this. As example, after came my ward, they observed me very closely. Every step they observe. If we doing something wrong, they urgently come to us. This is wrong. You have to correct this like this. Yeah, they are very good. They have very good follow-up care as well in nurses. So, and they are always helping people. Also, that's one thing. I have experience, I have skills, but here we are new. We have to adapt this new system. so we have to change our attitudes. But if you don't know something correctly, you have to say, I don't know, can you tell me how to do this like this? We have, as a nurses, we have this attitude also. If you don't know, directly say, I don't know, can you learn this, how to do this like this? It's very good. They are locals and other internationals, they are very good. They are ready to help. So always, if you don't know, they say, I don't know, can you help me to do this? Like this, they are very helpful. No need to worry about the system and other things. We have to learn. We are learning people, so we have to learn.
Yes, okay. So as a female, what do you think about Singapore? Is it safe?
Yeah, actually it's safe. Every day and night time, we are doing shift duty. So evening duty we start at 12 to 9. A bit late. So after 9 p.m. I stop my duty. It's okay. No need to fear here. Every people are very polite. Most of people are very polite and listen. If you don't know something, you can ask someone else. They are very kind people actually. I think if I don't know the road, they tell me, search the Google, you go there, you go there, you go there, see. Every detail see or we tell.
Yeah.
Yeah. It's okay.
Okay. And lastly, what you can tell to the next batches who are traveling as a nurse to Singapore?
Yeah, actually this is a good opportunity as a Sri Lankan nurses. We are Sri Lanka. If you have skills, if you have good education, if you have good experience, no need to wait. Please come to Singapore. Do your job properly and you can get promoted easily. Organize your work, organize your time, all the things. You can manage yourself well. You can go happily work with Singapore. Don't worry.
Okay. Okay, then thank you, Miss. I think you will be having a great future. Thank you.
Thank you so much.
What's your name?
I am Samir.
Sorry?
I am Samir Gayan.
Okay, Mrs. Samir. Okay, then I will start. So, Mrs. Samir, can you explain about yourself a bit and about the wards you work in Sri Lanka?
Yes, I have experience in about 13 years experience in Sri Lanka as general surgical medical ward nurse. Thereafter, I applied to Singapore. Now, I have been working in Singapore for 4 months.
4 months, okay. Okay, and you are working in top hospitals in Singapore, in the world. So, what do you feel like that? What do you think about that?
It's a new experience, and we have to work with various persons from various countries. It's a new experience, and they have good knowledge. Sometimes it's very competitive. That's why Singapore, my hospital, become, I think, in the first grade level among hospitals.
Okay, and are you an enrolled nurse?
Yes, I started as an enrolled nurse training.
Okay, so what do you think? Is there any opportunity to get promoted as an enrolled nurse to a registered nurse in Singapore? Is it possible?
Yes, it's possible. I think you have to work 1.5 or nearly 2 years to get RN promotion as RN. It's possible with diploma.
Yeah, okay. Now you are almost working for 4 months there in Singapore.
Yeah.
So how do you feel to find the facilities there?
Yes, facilities, everything has like a system. Everything is in our mobile. We have to use various app tools. It's very when we are just, it's very easy to live in Singapore.
Yes. So the innovation is part of nursing culture in Singapore, right? So how you all are adapted to these innovations in there? It's different to you, no? So how you feel about it?
I already mentioned this is it's very competitive.
Yeah.
Everybody must cooperate with this, and their knowledge and their abilities. Sometimes we have to use our hidden abilities. That's like that. It's a good thing.
Okay. And so there will be some language barrier issues when you all are joining the first day and for the training sessions in the Singapore hospital. So how you all are managing with this language barrier?
Language barriers. I couldn't find any language barriers because Singapore is not like very good speaking in this country. Most of Chinese and Indian and others. But nobody cares about the field problems their house with language. But we can understand, we can manage everything.
Okay. So what do you think about being a nurse in Singapore? Is it recommended Singapore nursing as a step in your career growth?
Yeah, Singapore I think is the best place to start as a nursing career. You start with low level and you can go high level in short durations.
Okay. And what do you think about Singapore? Because most of the Sri Lankan female nurses are traveling to Singapore. Is it safe for everyone to work there in Singapore?
Yes, not Sri Lankans, well, it's other all are humans.
Yeah.
Most of countries, they are safe because CCTV cameras and police around always. Nobody to allow the wrong things to women. That's Singapore is very safe country.
Yeah, okay. And what you can tell to the next batches who are traveling to Singapore as a nurse? Can you recommend this to them?
Yes, I can recommend Singapore. Start your career in Singapore in low level, and you can go high level in a very short period. And if you have experience in Singapore hospitals, you can go and work anywhere.
Okay, then thank you, Mrs. Samira. Wish you all the very best. Thank you so much.
Thank you very much for your
Hi. What's your good name?
I'm Malki Rajapaksa.
Okay, Miss Malki. So, can you tell us a bit about yourself and what are the boards you work in Sri Lanka?
I'm Malki Rajapaksa from Mahamali, Colombo. Previously, I worked at National Hospital of Sri Lanka and Colombo North General Hospital in Colombo. In National Hospital of Sri Lanka, I worked as a theatre nurse, and in Colombo and North Colombo General Hospital, I worked as an award in the urinary the medical ward, and 6 years experience I have.
Okay. So you working in one of the top hospital in the world. So what is like working in the top hospital in the world?
I work in Singapore at the Tan Tock Seng Hospital. It is the largest hospital, I think second largest hospital in Singapore. It is a good hospital. The staff is almost good. They always help to increase our knowledge. They have us learning materials. Always they give us to complete some assignments, and they have any lectures, any updates for nursing career, to update our nursing career.
Okay, just sorry, ma'am. Okay. So you working there as an enrolled nurse, right?
Yeah, enrolled nurse.
Okay. So how long you are working now in Singapore?
3 months.
3 months. Okay. So as an enrolled nurse, what you feel, is there any opportunity to get promoted to enrolled nurse to a registered nurse?
I think the hospital decide what is the performance we do. They evaluate us always. Some procedures we done, the nursing clinicians and nursing sisters will always look after us, what we do and what we done, that the procedure. So they decide when we do our performance well, they decide to upgrade us.
Okay. And from what I see, the innovation is part of the nursing culture in Singapore. No? How you adapt into this innovation?
Totally different than Sri Lanka. All things are updated by the system. All are system wise. First 2 months, seriously we had some barriers about the language and the communications, then the technology. Later now we can adjust all the technology system. They always updated in system, but in Sri Lanka we always write down the paper, but there is no more papers, always in updated by the computer.
Okay, so almost four months in Singapore, right?
4 months.
Okay, so how do you find the facilities there?
They are always have the apps, bus app and the shops sometimes. So we find, I'm with my friend, so we are together. We always find some new things. In our off days, we go everywhere to get a new experiences. So it's good.
Okay. So there will be some language barrier when you adapt into their language and the nursing training. When the first day you join to the hospital, so how you all manage to that?
It's lots of people. Singaporeans use the Malay and the Chinese language, Mandarin.
Okay.
In the first day, seriously we cannot understand some words. Older people cannot understand English and cannot speak English, but the new generation can understand and can talk with English. So the staff always help to communicate the others. Now we have some words. They always use some words, so we teach all the things.
Okay. So what do you think about being a nurse in Singapore? So is it recommend you for the Singapore nursing as a step in your career growth?
Yes, Singapore is a good opportunity to develop our career.
Yeah.
Because I think almost Singapore nursing is a good than the others countries. I don't know how, but I think this is the good for the future career, updated our future career. Always they done their procedures in a protocol wise, so they are always in the time frame, protocol frame, so they easily understand and always can learn something.
Okay. And what do you think about Singapore? Is it safe? As a female, what you can tell
Yes.
others? Yes.
Mostly safe because our evening shift almost off at 9 p.m. So we can sometimes we reach our home at 10:30 can and go alone. It's safe.
Okay. And lastly, what do you tell to the nurse badgers who are traveling as a nurse to Singapore?
Singapore is good, but there is some expensive, but it's up to you. You always you can save money, and it's always up to you, I think.
Okay then. Okay, then thank you so much, Miss Malki. Wishing you all the very best.
Thank you.
ඔබටත් ලෝ ප්‍රධාන පෙළේ රෝහලක රැකියාවක නිරත වීමට දැන් අවස්ථාව තියෙනවා. සිංගප්පූරුවේ හෙද රැකියාවකට අයදුම්පත් යොමු කරන්න එමරල්ඩ් ලයිල් මයින්පවර් ආයතනයේ 4 වෙනි කණ්ඩායම හා එක්වන්න පුළුවන්. ඔක්තෝබර් මාස 22, 23, 24 යන දිනයන්හි සම්මුඛ පරීක්ෂණ විදේශ නියෝජිතයන් සමග පැවැත්වෙනවා. ඔබගේ SMP විභාගය 25 වන දින පැවැත්වෙනවා. ඔබටත් ඔබගේ හෙද සීනේ සැබෑ කරගන්න කැමති නම් එමරල්ඩ් ලයිල් මෑන්පවර් ආයතනය හා සම්බන්ධ වෙන්න.
Contact us hotline 0114 335 444. WhatsApp numbers 0766 203962, 077 3472186 and 0773 3277769. Our email address nurses@emeraldisle.lk.
Please follow us on social media and website.